Hello everyone, thank you for tuning in. Today Ashley, Sydney, and I will be focusing on informatics and technology in the healthcare setting and how it's specifically affected the nursing world as we now know it. Nursing now states, in a nutshell, informatics is the science and art of turning data into information that we can use to make decisions. The focus is on the management of that information, which is generated by the data collected through the use of computerized systems. A specialty that integrates nursing science, computer science, and information science in identifying, collecting, processing, and managing data and information to support nursing practice, administration, education, and research. Nursing now defines technology as a use of science and the application of scientific principles to any situation, often involving the use of complicated machines and computers. Not only does technology change the way in which people communicate and work, but it also creates a new decision-making process that affects all aspects of industry and commerce, including healthcare. Nursing has greatly evolved with informatics, and with the amount of online databases, information is easily accessible to both providers and patients. This can help ease anxiety for patients as they can easily educate themselves on treatments and procedures. Technology and informatics has completely transformed how healthcare is operated. It's almost unimaginable how we would go about day-to-day operations without it. Charting, monitors, medications, even IV pumps, all of it revolves around technology. Newer technologies are helping to keep patients safe both in and out of the hospitals. Something small but noticeable is bed and chair alarms. While not the nicest things to hear, they are key in fall prevention. It's hard to imagine how tasks were completed before current technologies. Paper charting is one thing, but imagine the wait time for results. Whether it's a CBC or an MRI, we're accustomed to a world where these are right at our fingertips within hours of them being taken. Computer charting has been said to decrease many errors, with many people being able to access it as well as not being concerned about whether it's legible and being able to know who charted what. The process is much simpler. Nursing education is obviously also something we know is evolving. Before all of the advancements, we may not have been able to continue our semester this year. Simulations, both online and in the classroom, also weren't possible, and research materials weren't as accessible. Informatics and technology have transformed treatment options. With new robotic surgeries being far less invasive, healing time has been greatly reduced. Operations that used to require multiple day stays are now done on an outpatient basis. Obviously, we all know what's been going on in the world. There's no way to get around it. But I think the question that's been on a lot of people's minds is just how long has it been going on? A few people that I know have said, well, I got really sick in December. Was that COVID-19? Another concern that's been on many people's minds is that they've had some symptoms of COVID-19, assuming that it was a common cold and it had possibly been exposing to someone with a weaker immune system. Thanks to developing research, we may soon be able to know if we had indeed been infected. With limited amount of tests, many people have been wondering what the real number of cases actually is. What if people were just asymptomatic? Studies like the one at the National Institutes of Health in Maryland will help paint a clear picture of the true magnitude of this virus. Testing will allow researchers to know if the person has previously come into contact with COVID-19. The hope is that it will shine light onto why certain cases were much more or less severe than others. This is just one example of how informatics is used currently in our field. Telehealth has been evolving over the years, with it being less expensive for patients and a way to lessen the time in the waiting room. It's great for both parties. It's also evolving emergency medicine and helping those in less populated areas. Currently, people are opting for telehealth because they're sick, but afraid going to the doctor or urgent care may end up actually making them sicker. Because of this, insurances are lowering or even waiving fees at the moment so that they can be treated, but from a safe distance. Those in rural areas just don't have the same options as larger cities. Telehealth has been a great option to reach those folks and intervene. This option allows better monitoring and results in a better quality of life for them. Utilizing telehealth in emergency situations, emergency workers are able to intervene with guidance en route to the hospital. This often results in them both being able to save lives as well as prevent permanent disabilities.
It's no surprise that the use of informatics and technology has had wonderful benefits in our healthcare system. I will now share with you just a few of the ways that health informatics and technology have drastically improved the world of healthcare. Informatics and technology in healthcare have reduced cost by making care delivery timelier and more accurate. This leads to fewer dollars being spent fixing malpractice errors and by reducing the amount of time nurses spend on tedious tasks. The use of technology in the workplace saves millions of lives. Simple tools such as automated oxygen saturation readers, cardiac telemetry, and glucometers make it easy to track patient progress and gives nurses more time to remain present and engaged with their patients. The efficiency of documentation is a huge benefit of integrating informatics and technology into healthcare. Documenting in an EHR helps keep the patient's progress of care more up to date and saves time without having to rifle through papers that are hard to keep track of and update in real time. New and exciting job opportunities have been created with informatics and technology on the rise in healthcare. Those who are passionate about focusing their career around this niche specialty can seek out a job opportunity to become a clinical informatics analyst or a nursing informatics specialist. A difference in culture and socioeconomic status influence the practice of nursing around the world. Some countries are impoverished, leading to a decreased use of informatics and technology in their practices. Oppositely, countries with more funding toward healthcare are working on new technologies that are current and innovative. Underdeveloped countries such as Mozambique do not have much access to quality healthcare in general, let alone the use of health technology. Limited access to healthcare can be difficult as it leads to an increased rate of morbidity and mortality in the population, although there is a silver lining. Recent studies have shown the use of smartphones to improve access to healthcare in underdeveloped countries. With the cost of smartphones declining, it's easier for these countries to utilize text messaging to communicate with physicians, send pictures of suspicious wounds or other tissues, and to receive education about disease processes. Countries with more funding toward health technology are working on exciting new innovations. China is currently working on integrating artificial intelligence to help bridge the gap between number of physicians per 1,000 citizens. Our neighbors in Canada have a market size of $90 billion going toward developing health technologies, putting them on the forefront of exciting innovations in stem cell research and nanotechnology. The use of these new technologies is predicted to completely change the world of healthcare as we know it. The use of informatics and technology in healthcare has made communications amongst healthcare providers and patients so incredibly easy and has in turn improved quality of care. And here's how. Gone are the days of pagers and lengthy phone calls as clinician-to-clinician communication has improved using text messaging and instant messaging to get a hold of each other more efficiently. This gives healthcare providers more time to spend on treating their patients rather than tracking each other down to relay information. Continuity of care has been drastically improved with the use of informatics and technology by making it easier for all healthcare providers to translate information about a patient to one another. All patient info, test results, orders, and progress notes can all be found in one place, making the healthcare continuum maintain a steady flow. Technology has also improved patient-to-clinician communication in several ways. One of these ways is the use of the call bell and pressure sensor alarms that can alert the nurse when a patient is in immediate need or when a patient who is at risk for falls gets up from bed. Patient communication with nurses and doctors has never been easier than with the use of smartphones. Patients can schedule appointments online, instant message or video chat with their nurses or doctors from home, and explore treatment options through research on the internet. The ways in which informatics and technology have improved patient care and the patient experience are endless. From increased patient participation to better patient outcomes, satisfaction, and quality of life, the use of informatics and technology could be held responsible. Patients' participation in their healthcare is more evident now than ever before due to having access to various applications on their cell phones and computers that make it so easy to view their updated health records, prescription instructions, and that give them access to materials to help them keep up with health maintenance. Informatics and technology improve patient outcomes and quality of life by providing nurses and doctors with the tools necessary to keep track of patient progress and keep themselves up to date with the most current evidence-based practice. This leads to fewer medication errors and reduced length of stay for patients in the hospital. Patients report a higher satisfaction rate on surveys when hospitals are more digitally sophisticated, such as having streamlined communication, high-speed internet, and flat-screen televisions in their rooms. Patients are more in control now than ever when it comes to their own healthcare needs, as lots of healthcare equipment has been made to be used at home. Devices such as personal insulin pumps, bedside CPAP machines, and dialysis machines can all be used from the comfort of one's home, which improves patient satisfaction and quality of life.
Downtime is any point in time when the electronic health record system is partially or completely unavailable. These periods of time are disruptive to operations and present risks to patient safety. Preparation before downtime occurs is essential and includes staff training, written material that's easily accessible, specific downtime computers and printers, and practice scenarios to identify ways to improve. Additionally, downtime carts are useful tools to have on each unit. These carts contain downtime forms, labels, wristbands, and reference materials, which allows the transition from electronic to paper to go smoothly with little disruption to staff productivity. Because the downtime process requires charting in handwritten form, ensure all forms are used appropriately. Blue or black ink is used and legible, and all documents are signed and include a date and time. Downtime can cause risk to patient safety. Web-based avenues and cloud options are great alternatives to digital software and may prevent harm that can occur to patients and their information during a downtime event. Downtime can feel and look chaotic to patients and their family members. Ensure you are taking the time to communicate with patients to keep them up to date. When the electronic health record system is completely unavailable, systems stop talking to each other. This can cause lab errors, such as incorrect specimen labeling, and inability to track and patient identification errors, in addition to medication errors, which include delays, wrong dose, and wrong medication. Strategies to restore patient charts when the computer system becomes available are based on the length of downtime that occurred, but always include uploading paper documentation into the EHR. An influx of staff for chart restoration and reconciliation may be necessary. Privacy risks should be considered with the use of electronic health records in nursing informatics. Patient confidentiality can be breached if the wrong person gets a hold of important information. A data breach can occur by a staff member not logging off of their computer, illegally accessing patient files, giving away passwords, not shredding private information, and by texting patient information. Luckily, patient information is protected by audit trails that show when the record was accessed and by whom. This ensures that a patient's chart is only accessed by medical staff providing care or treatment to the patient. Additionally, data is difficult to alter in an EHR. Worm, write once, read many programs exist to make altering a record difficult. All changes are logged by date, time, and the person making the changes. Nurses and other caring for patients have an ethical and legal responsibility to protect the privacy of the patients. In addition, patients have a right to expect that their personal information will be used correctly and kept secure. The Health Insurance Portability and Accountability Act was created to allow patients to be transferred between providers while providing regulations for the privacy and security of the records during the transfer process. HIPAA was established in 1996 and is known for providing guidelines related to privacy for patient protection and the abuse of health information while ensuring the proper individuals have access to patient records. A HIPAA violation comes with a hefty price: employment termination, loss of license, fines, conviction of a crime, and prison sentences may result. Technology has come a long way to include electronic charting, wireless communication systems, real-time location services to track equipment, wireless patient monitoring, and smart TVs to allow for patient education. In addition, the evolution of technology has allowed for automated IV pumps, portable monitors, wearable devices, centralized command centers, telehealth, and an abundance of educational apps, to name a few. Advancements in the future of nursing, informatics, and technology will improve operations, simplify data collection, tracking, and analysis, and allow real-time access to patient information anytime and anywhere. More and more lives are saved each day because of the advances in technology, which allows for advancing care for patients. Nursing informatics and technology allows patients to feel empowered and will continue to advance every single day.